is a bit of a construct. You can understand fatigue in the situation that it happens normally, and in people that experience normal fatigue, everyone does. It's a tiredness or a lack of energy, and in normal fatigue, it's in response to a period of physical exertion, and it may improve with rest. But where it's pathological or where it's abnormal is where it doesn't improve with rest, or it occurs when you are resting and you're not, in fact, putting your body under any particular pressures that might result in normal fatigue. If that happens for a period longer than 6 months, just by definition, it becomes a title, which is chronic fatigue. And people that have been labelled with chronic fatigue syndrome are a big collection of different people with different problems, all having that sort of shared experience of fatigue for that duration of time. The word fatigue sort of encompasses lots of things, and there are subjective interpretations of what that means. We're trying to get objective measures in order to sort of measure and then therefore find some management strategies which we can measure whether they're effective. But fatigue as a construct is tricky to measure. Muscle fatigability comes into it too, and then exercise tolerance, which in a way are slightly different concepts, but all relate to the experience of fatigue. So causes of fatigue in any individual. So there's primary causes to do with disease mechanisms, and I'll talk about Mito on the next slide. The secondary things, meaning additional things that may contribute, and that includes things like medication, pain, physical deconditioning. We know that patients, when they haven't been moving for a long time, will experience deconditioning, where they would experience fatigue in their muscles, in addition to potentially some weakness. Anemia, cardiac and respiratory dysfunction, and those three things just relate to how well you can get oxygen to the area that needs to be working, and your exercise tolerance. Mood-related factors and sleep disorders contribute to fatigue. Sleepiness is a slightly different concept, and that is, excessive daytime sleepiness might be your propensity to fall asleep, but sleep deprivation can also, related causes of that might also impact on a fatigue rather than sleepiness. So thinking about the disease process of mitochondrial disease, we know that mitochondria are very important for oxidative metabolism, and that's important for energy use in your whole body, but in particular those areas that use a lot of energy, like your muscles and such. If you have deficient energy production, then your exercise tolerance may not be as good, and you might have that sort of fatigability at low levels of exertion, and in addition feel tired. There are complications of mitochondrial disease that might impact as well, and that's things like anemia, muscle disease, heart disease, respiratory muscle involvement, and potentially central nervous system damage as well. I didn't put that there, but can all result in either perceptions of fatigue and also measurable fatigability. Also, there's a psychological impact of disease, and we know that in mitochondrial disease, and I think that the Mito Foundation have done a really nice survey recently showing, or maybe not that recently, a little while ago now, showing that there's definitely a psychological burden of having the disease, and your psychological impact on your experience of fatigue and interpretation.